Hello, everyone. In the world of medical communications, we frequently use terms such as CME, CPD, or MedEd. But do they mean the same? See, there is a very thin line of distinction between the ideas of educating a clinician versus helping them in their professional development versus promoting a product. But for someone whose role is compliance driven, understanding these distinctions is very crucial. So let us try and learn about these various terms in this module, which is the second in the playlist of medical communication industry insights. So this module will talk about CME versus CPD versus promotional MEDED, medical education. So just to give you an idea about the landscape, CME, if very broadly, if we think of CME is about providing a specific accredited scientific knowledge on a clinical topic. So, what exactly it is talking? It is talking about the what. Okay, so in CMEs, the clinicians would learn the scientific aspects of a particular clinical topic. Now, coming to the CPD, CPD is a much broader concept. So, in a way, CME forms a part of CPD. However, CPD also covers many other aspects, such as because it is related to the entire professional growth of a physician. So, it will also include the communication, it will also include the practice management. In fact, it will also include the mentoring done by the physician, mentoring of some junior colleague. Now coming to the promotional MEDED. So promotional MEDED is it promotional medical education. As the name suggests, the commercial angle is very much there in this term. So it is about providing information on a particular product, product of pharma interest to influence clinical practice. However, even this promotion has to be supported by adequate scientific evidence. So, in a way, it will talk about the why a doctor choose a particular therapy. So, CME, the clinician will learn the what in CPD. CPD more or less encompasses all the aspects of their comprehensive improvement, and promotional merit is certainly about the promotional marketing, promotional education material for a particular product. Now, if in a very simplified way, if we think about the difference between these three terms, it primarily they differ when it comes to the bias. So bias, CME, a certain no for bias. CPD, again, it must be independent. However, promotional method, as the name is suggesting, it would be biased towards a specific product. So let us go ahead and talk about CME first. So primary goal of CME is to maintain, develop, or increase the knowledge and the skills. See, now the physicians, the practitioners attend a CME to strengthen their existing knowledge based on latest updates and evidences on a particular clinical topic. Right. So, the key characteristics of the CMA would be first thing, the CMA would be accredited as if formal accreditation bodies such as AMA or FOGC or ACC would give some credit points, and even doctors need to keep building on the credit points for getting their licenses renewed. Second point, so first, CME would be accredited. Secondly, it has to be unbiased and independent. And with this new UCPMP, which has been enforced by the government in 2024, as we covered in the first module of the series, a pharma company cannot control the functioning of a CME. It can provide hands-off educational grant to a CME event. However, it has got no control over the KOLs and the content. And thirdly, as we discussed, herein in CME, the physicians gather to gain insights on a particular topic. So all the content must be based on the latest updates and the latest scientific literature, and it will be topic focused. Certainly, it will be topic focused. So, example would be a symposium happening on the latest advances in heart failure management. So, the topic of interest here is heart failure management, and it would not be talking about a particular product, but as a whole, it would talk about the latest updates and new insights in the field of heart failure management, and it has to be conducted, organized by an independent scientific association such as Cardiological Society of India. It can be funded an unconditional grant from the different pharma companies. Now, let's talk about CPD. So, CPD, as we learned at the very beginning, it is a broader umbrella which would encompass CME, but it will also include, it will include the intangible component also. In CMEs, the physicians are getting the credit points objectively, right? However, CPD as a whole would talk about 360-degree professional development. Okay, so maybe we can, I like this analogy very much. So, whereas CME is a sort of marathon, CPD is a sort of daily healthy lifestyle behavior which we are trying to inculcate into practice. So, it will include yoga, it will include meditating, it will include morning walks, it will include a balanced, healthy diet, and in between, running a marathon would also be a part of the CPT. But CPT is again, as we discussed, it is a broader self-directed process that encompasses all of the physician's learning process. It will include CME, but a lot more as we discussed. So the talking about the key characteristics, first and foremost, not just the credit points, it is holistic. Not just the clinical knowledge, but also the professional skills like communication, team leadership, ethical practice, and even financial management of a clinic. Then it has to be self-directed. Herein, no scientific association. Okay, scientific association is organizing CMEs. You are being a part of it, but otherwise also, it's a continuously ongoing process, and the physician has to drive it, identify his or her own areas of improvement, and undertake activities accordingly to improve on those areas. And many a times it is non-accredited, not with these CPTs don't come with formal credits but are vital for the professional growth of a physician. So the example in this case would be a cardiologist completes a CME on heart failure. Okay, now she takes up a workshop on communicating difficult news to patients. So see, communicating difficult news to patients can't come. It's not. A clinical topic which will have new insights and would become a CME. However, it will form part of our CPD portfolio. So now, towards this is the third topic and the last topic, promotional MedEd. So this is any educational activity here in direct control. Pharma would control it directly and is sponsored and controlled by a pharma company with the intent to promote its product. By definition, it has to be commercially biased, and however, it has to be transparent, and that particular molecule of pharma's interest has to have adequate supporting scientific evidence. Okay, so everything needs to be scientifically evidenced. And as we discussed in our earlier modules, we as a part of Med Affairs team, we have to ensure that whatever information is going into this promotional MedEd content, even that is also referenced properly, right? It has to be annotated properly. So the example would be a company-sponsored webinar for oncologists titled "The Role of a Particular Drug in the Management of HER2 plus Breast Cancer." Okay, and herein the pharma the pharma has a say on the KOL choice also. The key characteristics of a promotional MedEd content would be, it would be product focused, certainly. It would be company controlled, we already discussed. And it has to be the content again. See, this I was talking about. Whatever, despite the fact that it brings commercial angle along with, it has to be whatever content is going over there. It has to be compliant. It has to be supported by adequate scientific evidence, fully compliant, present fair balance, discussing risks as well as benefits, and be based on the approved product label. So, just to summarize, if we look at primary criteria wherein these three categories of medcoms products differ, it would be like CME. If we talk on goal part, so CME, the goal of CME is to update clinical knowledge on a particular topic of discussion. CPD includes covers the overall professional practice, professional improvement, and promotional MedEd is the purpose, the intent of the promotional MedEd is to influence clinicians' behavior for prescribing a particular drug. However, it has to be scientifically approved and uh, evidenced, supported. Content-wise, the CME would focus around disease state or therapeutic area. CPD will cover all the professional skills, and promotional method would be the content focus would be around a branded product. Bias, CME and CPD they have to be unbiased, whereas promotional method will, as the name suggests, it is biased, and pharma's role in the first two parts, there is no role of pharma's. However, it is a promotional method is being controlled and sponsored by a pharma. Now, strategically, how it becomes important. So first, again, compliance is paramount, right? So, for example, CME presentation deck cannot have a brand name in any of the slides. And likewise, a promotional MedEd won't can't be accredited. The credit points cannot be given for a purely promotional event. So, if we talk about building trust, CME is around building trust, a well-executed, unbiased CME program, and driving sales. Promotional MedEd has to drive in some good sales figures. Talking about the resource allocation, knowing the goal would help us allocate the resources effectively. A deep scientific CME requires a different budget and a skill set than a fast-moving promotional webinar. So to conclude, as a strategist, your job is to choose the right tool for the right objective. Are you trying to build awareness of a disease state? CME would be the answer. Are you trying to communicate pivotal brand data? Then promotional MedEd would be the way ahead. So thank you with this and stay tuned. Have a good day. Bye-bye.